So I think I can figure this out, and you got it. There it is. All right, so my name is LeShaundra Cordier, and I'm the Associate Director for Communications at CDC. And to Shiloh's point, the thing that motivates me is Beyonce. I was hearing her earlier. I wish I had more of it. But where she was talking about the individual change component, I'm going to be talking about changing at the broader scale, but with providers. So we're going to talk a little bit about clinical guidelines and how the impact of how that impacts opioid communication strategy. So let's see if that works. Yay, okay. So I'm going to start with my bottom line up front. I'm actually going to start with the end of my presentation at the beginning. So what you see in front of you is kind of the problem statement, right? Which our ultimate problem is opioid overdoses and related harms, and how we prevent them has been the work of CDC for quite some time now. But the important part is the graphic. I'm going to tell you a little bit about how the work we did in the clinical space actually informed this graphic and our approach at CDC. So you can see on here that we are focused on building capacity, focused on supporting providers and health systems, as well as educations for consumers and state support and surveillance. Okay, I'm gonna not get click happy, okay. So the solution to our problem actually was brought about in 2016, which you can't see the graphic image, but I can. So I'll let you know that this is the CDC guideline for prescribing opioids. Has anybody heard of it? Hands. Oh, good. It's been a couple years, so I'm not surprised. But essentially, the guideline was intended to inform clinicians and the work that they do and how they have safe discussions with patients about about opioid prescribing. So working with them on the benefits and risks of opioids and helping them manage what they need to know in terms of making informed decisions. So what's important to know about this is that it was intended for primary care providers, patients who were 18 years and over, and making sure that we were in outpatient settings. So for this, I wanted to let you know that in terms of challenges, the biggest issues were stigma, misperception and misinterpretation, as well as the growing visibility of the opioid epidemic, because we kind of started this before it became the broad scale issue that you know today, so that increase in visibility caused a lot of issues with our messaging. I also want to point out that something that's important for people is when you're releasing clinical guidance, CDC is a non-regulatory agency, so I can't force anybody to do anything, although Beyonce can. And I want to go back to her. She does have a really good way to motivate people. But that also created a challenge for us in terms of helping with adoption and uptake. All right. So that slide I showed you before with those 5 kind of pillars, these are the 4 original pillars that actually outline the work that we did around clinical and provider education. So you see that we took an audience-centered approach, with clinicians being our primary audience, and we had 4 key component areas that we really worked on providing information for. And what's important to know there is that each one of those had a purpose. First, we started off with the need to distill information to really ensure that the providers we were seeking and outreaching to understood the information we were giving them, could take that information and apply it. We also worked really closely with them to support capacity. That was with training and education. Providers, as well as those that they serve, also needed that education, so we built an education model around that I'm going to talk about shortly. And then working with disseminating and evaluating our information, which 3 and 4 on the slide, the health systems intervention, and then ensure interventions were to help outreach to people who actually talk to providers. So we wanted to work with the people that worked with providers, as well as provide them with the information that they needed to make the decisions that they made. So, translation. The first kind of key component in talking about what we did and the impact that we hoped that it had was really looking at the science and the guideline itself. Like I said, distilling that down into usable, audience-centered, audience-specific content that could be tools, resources, and other components that could help them digest the information, apply the information, and implement it at a broader level. We also wanted to take the concept and the model of knowing the fact that effective communication really, and translation really works to help raise awareness, generate buy-in, which helps us with the concept of encouraging adoption, and then encouraging behavior change at a more fundamental level. If you have the tools to do it, you're more likely to do it. So we worked through that to create consumer education, clinical tools. We actually designed a mobile app for our providers. We also did digital and print resources in the form of social media, toolkits, webinars, and other provider content for them, and then worked on a suite of materials for consumers, for insurers, for state health departments, all those that healthcare providers actually work with, to help create the implementation process and help with the adoption components. We also took that information and use it to evaluate. We consistently get feedback and collect feedback from our materials to try to get a feel for what gaps exist, try to understand what resources could be improved and how to improve them. And so doing that was a kind of feedback loop that we continue to do to this day. So capacity building. Clinical education and training is a big component. And if you're trying to encourage behavior change for anybody, education and training is a big component, whether that's people who are going to be delivering your message or if you're going to be delivering your message to your end user. It's important they have the tools that they need, the information that they need, and the resources to execute and implement your changes that you want. So we took an e-learning approach and developed content around what our audiences said they needed. We asked providers, what would be helpful to you? Short webinars, done. We asked our providers, what kind of information would you like to see? All of the 12 recommendations in the guideline are covered in multiple modules across our training program and our webinar series. We also created learner-directed content, created avatars, case-based scenarios, all based on real cases, real providers, and we worked with clinicians to develop tools for clinicians. So that last two bullets of health system interventions and insurer practice interventions, we also really sat down and decided what would be important to providers. We recognize that they don't work in a vacuum. Not too many people do. Does anybody work on an island? Not like a figurative island, not a literal island. Right. So collaboration is incredibly important to what you do. And so we took that same approach. We recognized that providers needed to have more structured content in a bigger, broader healthcare system level and needed support in that space to be able to implement change. So we worked with them to focus their broader needs. We developed provider content for health systems, specifically for health systems, working with them on clinical decision support tools, integrating information into electronic health records, and helping them with PDMP integration, prescription drug monitoring program integration. So what that means is we've actually built prompts in electronic health record systems that allows providers to know when they should be checking the PDMP. It notifies them when they're prescribing doses that are higher than the allowable morphine milligram equivalent. And we've asked them to really work on thinking about what other prompts would be helpful to them that actually key into the guideline that we developed. So outcomes. I would be remiss, and I wouldn't be CDC, if I didn't say we did something successful. We got Beyonce to come. No, I'm just kidding. So one of the components of our work is that we've had an effective impact on establishing kind of clear measures of success for us. What that means for us is reducing prescribing, encouraging prescribing best practices, reducing overdose deaths. Those are our big, broad goals here at CDC, and we've achieved them. Not to the level that we would like, we're still consistently achieving them, but this just shows you some impacts. I will spare you a logic model for those of you who work in public health. We did have several, but we are starting to achieve those outcomes that we've desired. So that includes the data showing us that a majority of counties in the US have seen declines in the rate of prescribing. We've seen declines and reductions in opioid prescribing with multiple medications. We've also seen reductions in the number of patients receiving overlapping prescriptions with like benzodiazepines. And then really starting to see some of the outcomes and other process outcome metrics, an increased rate in prescriber taking education practices and going through our trainings. We've had over 40,000 learners that have completed our modules that are still going. We've partnered with groups like Medscape and others to make sure that that continues. We've had over 107,000 downloads to our mobile app, and that is continuing to grow, which means it's also being used and being evaluated. We've seen increases in awareness around the dangers of prescription opioids, not only from providers, but from patient populations. We've started evaluating and surveying consumer products and seeing that there's been an increase in what people truly understand about the risks and dangers of prescription opioids and how to better use that information moving forward. All right, last slide. So, what does that mean? So I started with the beginning, saying that I was starting at the end, and the end is that the drug overdose crisis is complex. It's a changing landscape. And as we change, and it changes, so should our messages and our approach. It should be something audience-centered. It should kind of hit those big pillars around education, capacity building, translation and distillation of information, really understanding that the epidemic itself, no matter what it looks like, needs to have an understanding to increase awareness. the role of data and how important it is to informing resources and choices that people make, and then understanding how to better collaborate across sectors to help prevent overdoses or whatever behavior change you're trying to accomplish, and making sure you're implementing that throughout.